Hello, and welcome to our first episode in a three-part series called Navigating Insurance, Denials and Appeals. CNF and our partners have heard from you that understanding your insurance plan and your financial responsibilities is a source of confusion and frustration. And today we're focusing on exactly that. How do you gather information and get organized to better understand your insurance policy and coverage benefits? To do that, I'm here with my colleague, rare disease advocate, Gay Grossman. Gay, welcome. Will you tell us a little bit about yourself and why this topic is important to you?
Hi, Jessica. It's really nice to
Hi.
be here. Thank you. First and foremost, I'm a rare disease mom, and I also lead patient advocacy and engagement at GeneDx, where we see a world where genetic conditions are diagnosed quickly and accurately.
So I'd imagine that you have a lot of experience in about what we're about to talk about.
I didn't know a lot about insurance before I had my daughter who's affected by a rare disease, but you don't really know about insurance until you need to access it. So
Mm.
once I started accessing it, it was really daunting to me because at the same time, I was taking care of a medically complex child. So I'm really happy to be here to teach some other families some tricks I've learned over the years. And one thing I would like to say to families is like, be gentle with yourself. This is a lot of information. It's not easy. And I certainly did not know what I'm going to share with people today when I started.
That's really good advice and the ones that I think that we can all really take to heart. So tell me a little bit about how insurance is offered and how families can begin to sort it out.
So that's a great question. The first thing that I say to families is know your plan, like really understand your plan. There are three different kinds of insurance. There's the private insurance, which is usually offered through an employer or you're paying for it yourself. Then there are programs offered in some states by state. And then there are also some programs through federal resources. Now, they vary state by state, but what I like to say to families is I know there's a lot and I know it's confusing, but you only need to concentrate on your own state. So, first, you can have up to three. And I've actually lived in a couple states where I've had to access resources. And one state was very different than where I live now. There are ways that you can find out what is available in your state. And we now have a resource, ChatGPT, that you can actually type in something. And I did this, Jessica, for, since you're in Kentucky, I use that as an example. And I typed into ChatGPT, I live in Kentucky. My child has been diagnosed with a rare disorder. Please tell me the resources that are available from Kentucky. And also let me know if there's a waiver program available and how I can access the waiver program. And ChatGPT is just a website that families can go to, and you put this information in. It doesn't cost anything to use this resource. It's kind of like a Google, but it gives you more direct information. And it gives you the phone numbers of exactly where to call and how to access some of these programs.
A great place to start as a way to kind of aggregate and compile all that information that could spend days, if not weeks, Googling. You mentioned a waiver just to make sure that everyone's on the same page. Could you tell me what you mean by that?
So some states do go by the income, the household income, and they will decide who can get a waiver and who is not able to get a waiver. It depends on the state you live in, but you can ask ChatGPT this information. Also, it's really important that as soon as you know that your child may have complex needs, that you apply for these programs because some have a waiting list and others it depends on the age of the child and when they were first diagnosed. So it's really important to access these services through the state and federal programs as soon as you know.
Thanks so much. And, you've got us on a really great start to discuss public insurance more, and we'll talk about some resources at the end of this video for people who want to follow up more with those particular questions. But let's talk about insurances that families are enrolled in privately for the sake of our conversation here. So in those cases, how do parents understand their coverage? And can you tell me why it's important to do all the work to get to the point where you do understand your private insurance?
Yeah, so this is a true partnership. A lot of people, and I'm going to put myself in the same camp, like I would get very frustrated with insurance companies, but until I really, would boil it down and understand my plan, it became much easier. And it really is a true partnership. And I'm probably going to say that multiple times in this webinar, but you really need to work with them. So know your plan. The first thing that families can do is, and I have some props here, like use your insurance card, look on the back, call the number and ask for help and explain to them, I have a medically complex child. I'm probably going to be calling back multiple times. Is there a resource with my plan that I can have a case manager that would give me a phone number that I'm talking to the same person every time? I can explain their complex needs, multiple appointments that need to be, visited, or, multiple providers, durable medical equipment, therapies, things that you're going to ask for multiple times that you don't want to call that general 800 number and explain it to the person on the other end. That is the best resource that you can have. And it cuts down a lot of frustration on your part, but also on the insurance company's part, because remember, they don't understand what you're calling about either. This is not a usual illness that you might be calling about, or surgery or something. This is ongoing, and you want to be able to talk to somebody one-on-one. So that's my first tip. The second thing that I recommend is really, like I said, know your plan. So this is my plan. It is 170 pages, this document. Now, this includes my plan, but it also includes information like if you want to appeal, how do you do that? What is covered, what is not covered? So what I recommend families do is you call your insurance company, again, using that general number, and ask them for a summary of benefits, or it's also called a summary plan description. Now, I will tell you, they will often refer you back to your HR department and say, call them for a copy, but they have a summary. And the example that I like to use is what I said when I had to call this, because Jessica, I did call my insurance to get an updated one for the purpose of this webinar. And I had to call multiple times because not everybody knew what I was looking for. But an example that I said to the person on the phone was, I'm looking for the document that, yes, I know speech therapy is covered, but I want to know how many visits are covered. So whatever that document is that you're referring to find that out for me, that's the document I need. And again, it's 170 pages. It could be more. So that's the document you want in your hands, and you want it in two versions. You want a PDF and you want the actual paper version. Now, I didn't want to print out that many pages, so I asked them to send it to me on paper, which they are required to do because it's an access, right? You need to be able to access it how you need to. You can use the PDF and use a search on your laptop. So if you're looking for whatever you're looking for, you type that in, and then it will find it on the page where it will be referenced. I have tabbed mine for things that we often refer to. I have also been known to let the representative know, I found it in my plan. It's on page 70. Please reference that. I know that it's covered. Could you help me so I can get it submitted correctly?
These are really good tips. Coming with receipts, doing your homework, making all these phone calls. I mean, that's a lot of work. I don't want to beat around the bush. So there's a lot involved in these tricks that you're telling us to get aware and confident of knowing what our insurance covers, excuse me. So can you tell us a little bit about how you've stayed organized and stayed on top of it with all of these, all the phone calls you have to make, all the documents that come in? How do you stay on track?
So there are a couple of things I've learned. And again, I want to say, I did not know this in the beginning, Jessica, and I had a lot of frustration too, but this is what I've learned. You have to stay organized. You have to take notes. I recommend to families, make these phone calls in the beginning of the day, because it weighs on you. So do yourself a favor, make the phone calls in the beginning of the day. And then as you are going about your day, if you leave your house and you leave all your notes at home, take a little notebook with you. And I had the same notebook that I would use. It would always be in my purse. So if I'm out in the middle of doing errands and they call me back, I can take notes and I can write down who I talked to, what time it was, what was the date, what did we talk about? Am I supposed to follow up on anything? Are they following up on anything? And when might I hear back? So you just have to be really organized about, how you keep track of things. The other thing that I do is I use, my calendar. So things like, getting things approved, like prescriptions or an IV that comes every month. When is that expiring? Put it in your calendar. If it's a 6-month prescription and it needs another prior authorization, put it in your calendar 4 months from now. So it triggers your mind to know to call about it or call your doctor's office. One of the other things that I suggest is, sign up for the portals. Make sure you have access to the portal with your insurance company and with your doctors and institutions. Keep all the passwords right inside your folder of the notes that you're keeping. Make sure you have access to those. The other thing I recommend is that people sign up for a fax number. You can get one online that's a digital fax number. The cost is less than $5 a month. And oftentimes insurance companies can fax things or doctor's offices can fax you things, but they can't email it to you for privacy reasons. So if you have a fax number and you finally get that prescription that you're looking for from your physician and you need to get it to the insurance company or you need to get it to the pharmacy, you now have a copy of it. And they do things electronically, but you can request that they send you a copy of it so you have it in your folder too. Because I think a lot of the times the time is like calling the doctor, calling the insurance company, and trying to get them to talk to each other. You can be a help in that process by having some of the information that's vital in your own records.
The great piece of advice. I would have never thought about a fax machine, but can see how that might
You don't
just
need the
make things easy.
machine.
Or not the machine, excuse me, the fax number.
Yes,
Being a bad millennial, not knowing my technology terms when it comes to
right.
faxes. So that's great. Any suggestions for how to mitigate some of the like emotional tax of doing this work? Do you find that calling at a certain time of day makes things a little easier?
Yeah, in the morning, like I was saying, like I used to drop my child off at school and I would come home and it would always be the thing I'd look at my list and it would be, the immediate like, oh, how long is this going to
Yeah.
take? But if you do it first thing in the morning, it's off your list, right? You've checked it off and then move on with your day.
Great tip. So in other conversations I've had with parents, some of the confusion comes around some of the terms that
Mhm.
insurers use. Deductibles, for example. Sometimes the most confusing part of the process is knowing what these terms mean and not feeling like you can ask for clarification. Can you explain a little bit about what a deductible is and how I need to take this into account when choosing which insurance to enroll in?
Yeah, so the first thing I want to say, Jessica, is it's okay to ask for clarification. This is a new language for you, just like your rare disease that you're talking about with the insurance company is a new language to them. So again, back to the partnership, like work with each other, be patient with each other. And what you can do is ask, you're using an acronym, I'm not familiar with that. You just mentioned something. Could you spell it for me? It's okay to ask questions and take it slowly. Like make sure that you have it. So when you move forward, you have everything you need, to make sure that you're getting your child what they need. So to answer your question about a deductible, there are two deductibles. There's the individual deductible and the family deductible. And a deductible is the amount that you need to pay out of pocket before your insurance kicks in and starts paying for services. So your individual deductible is just what it is. It's the individual, each individual in the household or that's on that plan needs to hit a certain amount. Now, my insurance card has it right on the card. It says the in-network, out-of-network, and it also has what the individual and family deductible amount is. So I know that I need to spend a certain amount before my insurance kicks in. So does my husband and so does my child. So there are three of us in our household. On top of that is the family deductible. Two people out of those three need to be included in that deductible amount to make the family deductible. So one person can't hit it. It has to be at least two hitting that deductible. Now, in my own situation, this is going to get a little confusing, so stay with me and ask me a follow-up question if you have one. My child does have coverage because of the state I live in. So whatever is not covered by my private insurance, that kicks in and covers her. So I know that she should be one of those two people who's making up that family deductible, right? Because she's going to hit that faster than any of the other of us. I schedule all of her appointments in January. So I know that right in the beginning of the year, I'm going to have her go see the neurologist. She's going to have her orthotics looked at. If she needs any testing, I'm going to schedule that early in the year. So she hits that one of two people. And then we just have one other that needs to hit the other. Does that make sense?
Makes total sense. I mean, it really too illustrates what you've been talking about, how some strategy and some homework really can save you a lot of time and frankly money in the long run. No, so that makes total sense. You also mentioned as you were talking about your deductible, in-network and out-of-network deductible. Can you talk a little bit about what in-network and out-of-network means and how that factors into this discussion?
So some providers will be in your network. So that means that they're covered by your insurance plan at a different rate than if they were out of network. So you might have a doctor, and as you change plans, that might change. So if you change your insurance plan, it's really important to talk to your provider or your insurance company to ask, are they in network in my plan? Now, here's one tip I have. If you call a doctor's office and you say, hey, do you take my insurance? And they may say, yes, I do. But the question to ask them is, do you take my insurance and do you bill it in network or out of network? Because they can take your insurance and they can bill your insurance, but you might be billed at a different rate. So it's really important to know. And the way to find out if something or if someone or something, and because like you said, I work at GeneDx. So if you're having labs done by GeneDx, you can call your insurance company and ask them, do you cover this lab or any lab you're going to for any test, whether it's genetic testing or not? Providers, same thing. Do you cover Dr. Jane Smith or not? Is she in network? Will this be billed in network? It's important to ask really detailed questions, and that's something to mark in your notebook and on your notes, the date you called, who you talked to, what you asked, and what the information was that you received.
So important, especially since out of network benefits are a thing. You don't want to, to your point, get lost in imprecise language and then end up with a surprise later because you didn't have that careful tracking of those questions. So
And I
excellent,
actually
excellent
get
points.
recommendations from other parents. So I will call the insurance company first. Say I'm looking for a neurologist. Call your insurance company. I want a list of all the in-network providers
Great.
that are neurologists that are in my zip code or within the mile range you can give them. They will give you a list. From my in-network choices, I then go to parents I know who live in the area where I live, who may be seeing a neurologist with their child. Has anyone used any of these neurologists? And then you get recommendations back. And I really use that as kind of my shopping list. I start with the insurance first rather than going the other direction of getting names and then, oh, are they covered? Start with who's in network.
Great, great advice. And honestly, so much of the conversation we've been having can apply to so many things that our families in the child neurology community experience. But let's circle back specifically to genetic testing. We get a lot of questions about genetic testing here at Child Neurology Foundation. I know you do too. And so, in your experience, could you tell me a little bit about what getting genetic testing looks like?
So I'm glad you asked that because exome and genome sequencing and testing is really becoming standard of care. So we're getting a lot of questions about this and access about it. Now we at GeneDx, we are a laboratory, so we cannot, prescribe or recommend what genetic test is given, or even if genetic testing is necessary. What we do is work with a partner that we have, Genome Medical. This is brand new partnership where we can refer families that resource, and then they can call and work with a provider there to decide, is it something that is right for them? What are the choices, and what genetic test would be most appropriate? Anybody can Google Genome Medical to see the how to contact them. There's also information on the GeneDx website, which we can include on the handout that will accompany this webinar.
Great. And I hear families all the time talk about how genetic testing and genomic testing is not covered under their insurance plan. What is your experience there? What does that look like?
So that is changing and has changed. Most major insurance companies are covering genetic testing. More than half of the states in our country are covering it under the state and federal programs. So we have learned with all of this, this being available, and this was not available, when we were going through this, trying to find a diagnosis, but now it is available for families, and it's important that they ask about it. They can, like I said, contact Genome Medical in order to get to the testing or an option for testing. But families need to know, as far as the cost, that knowing your plan and knowing what is covered is important, because you may think that the genetic testing wasn't covered when really it was because your deductible had not been met yet. And it's going toward that balance of the deductible. So it's important, if you get a balance, call and find out why there is a balance. Because the other thing is, perhaps it wasn't billed correctly. And going back to the primary insurance or the private insurance, the state and the federal, those have to be billed in the right order. So I can't tell you how many times I've gone to the pharmacy to pick up a prescription for my child, and there's a balance. Well, I know, because of her plan and the coverage that she has, she shouldn't have any balance. So then I say to them, okay, we have these different insurances. Were they all billed? Were they billed in the right order? And it always goes private first, state second, federal third. And if it gets mixed up in their computer and it went in the wrong order, it won't bill correctly. So call and ask. Just know this is how the process works, and help them. And again, partner with them. Like, it never helps to call and, be angry, and you can be frustrated. It's, we understand that it is very frustrated, but it's a partnership. Like, we all want to get our kids what they need, and just asking questions and being very thorough, recording information, being organized, follow through, follow up on these calls.
Yeah, you catch more flies with honey, right? And how much easier
Exactly.
to have that conversation if you've seen and feel comfortable and confident in what's in your summary of benefits and know what your deductible is. You'll
Right.
have such a more productive conversation and advocating for your child if some of those mistakes have been made that you mentioned. We're coming to the close of our conversation here. And so there's been so much great information shared. I just want to give you the opportunity, Gay. Um, what is one thing that you want the people watching this video to take away from it?
Can I give more than one?
Yeah, you could give as many as you want.
So I would say, ask for the case manager, partner with your insurance carrier, know your plans, know all of the plans, be organized, follow up, ask questions. The other thing that I want to mention is their financial assistance programs with many laboratories. And if you don't look at their website, you won't know about them. So, keep in mind what those things are. Now, there will be instances where something's not covered when it should be covered, and you need to appeal. And that leads us to episode 2, which is coming, and I'll let you talk about that.
That's great. I mean, thank you so much for taking something that just feels so confusing, so overwhelming, and really breaking it down for us to demonstrate that with a little bit of preparation, it really is possible and doable to figure out your insurance and make sure that you're getting the coverage that you've signed up for. So this has all been extraordinarily helpful. And I want to thank you for being here with us today.
Well,
And as
thank you for having me. And also thank you for partnering with us to share this information to your community.
Absolutely. And as Gay said, there will be accompanying resources for this video in CNF's learning portal, including our family support inquiry form where you can follow up with more questions about this and some other resources from our partners at GeneDx. Stay tuned for episodes 2 and 3, where we'll discuss appeals and additional resources, and those will be coming in December and February, respectively. If you're looking for assistance with specific questions about anything that we've talked today or any sort of resource navigation concerns, please visit childneurologyfoundation.org/family-support or email us at programs@childneurologyfoundation.org. Thanks so much for joining us.
Thank you.